what is behind, science behind SDS implants. Well, here I work as clinical affairs and responsible for the scientific studies. And I'm helping SDS implants in at least 3 different ways. In the product development, regulatory affairs, building up collaborations with clinicians and universities, and of course with the publications. I've been working with research for over 15 years, especially biofilm, biomaterial infections, involved with bone regeneration for a long time in my life. Initially, testing and confirming that 60% of endocarditis are caused by bacteria that migrate from oral infection. Later, involved with the Staphylococcus aureus, genetically modified, unable to form biofilm, and testing that in organs and soft tissue. And seeing that whenever you do not have biofilm, you reduce the infection also in these organs and tissues. And migrating to research related to implantology on the total knee replacement in rabbits, where we test ceramic and titanium implants. Look, when the knee receives a titanium screw and is infected with a wild-type bacteria, you have a severe destruction of the tissue, infection, pus, while you do not see that happening around the titanium screw where the knee was infected with this mutant bacteria. That means without biofilm, no development of disease. And at Zurich University, testing this mutant bacteria in a polymicrobial scenario, like the oral cavity, we test that in the supragingival model of periodontal disease. And in this polymicrobial ambient was not only the reduction of biofilm that we saw also a different communication in between these species. For instance, reducing the virulence of Streptococcus mutans, Streptococcus aureus, and in other words, if you reduce the biofilm, you also reduce the development of diseases such as caries and periodontal diseases. But not even the best research, science evidence is alone. It is the combination with patient needs and clinical experience that build up what we call evidence-based odontology. And that's what we see every day in our clinical experience. We are receiving patients with severe bone loss, receiving patients with biofilm formation, ill-fitting metal restorations, tissue recession. And the patients here in Swiss BioHealth Clinic, they follow a protocol that is called all-in-one, where all the issues are addressed at once to help the healing process. If needed, this patient received ceramic implants, SDS implants, and those are pictures right after the surgery. The patient also received provisionals, putting this patient back to normal life immediately after the surgery. This patient returned 4 months later in a completely different environment, received the definitive restorations, and you see here a picture before and after. You do not only see a reduction on the biofilm, but you see oral health. And now the question is, why Zirconia implants involved with oral health? And to answer this question, I ask you a second question, and that is, where is the implant here? If you are using Zirconia implants, you will have difficulties to answer this question. The implant here is at position 11. There was a failure root treatment that was followed by immediate implantation, provisional, and the patient came back 6 months later in these conditions to receive the definitive restoration. The answer to my question is very simple. Before, we all were very much worried about the osseointegration of the implants. Now here, everybody agrees that stable and long-term results depend on the healthy, soft tissues around this implant. And because zirconia implants have less plaque adherence, low bacteria, low biofilm formation, after implantation, you have a very early epithelial seal around this implant, which fastens the osseointegration of the endosseous part of the implant. And if you integrate this with a tissue-level zirconia implant, you also have the support of the crestal bone, which gives you a very predictable static results. And this is a little bit more challenging when we talk about titanium implants. Around titanium implants, tissue-level titanium implants, you do not have a seal, but a sulcus. There is a long sulcus formation. Around zirconia implants, you have mucosal seal, which is related to less tissue recession, prevention of peri-implant diseases, and this is an extensive protection to oral health, systemic health, and long-term results. And to test this hypothesis, we ran 2 clinical studies here in Swiss BioHealth Clinic, already published. In this study, we evaluated oral parameters, oral health parameters, systemic health parameters, and healthy aging parameters. All the patients underwent the all-in-one treatment, where all the issues are addressed at once. They receive SDS implants, zirconia implants when needed, and those patients were followed for at least 1 year after loading of the implants. We tested the parameters such as heart frequency and the balance of autonomic nervous system before and after surgery. And after surgery, we realized that was an increase on the parasympathetic activity and a reduction of the sympathetic activity, a better balance of the autonomic nervous system. And that was consistently. And we know that activity of parasympathetic system is related to a better capacity of our body to heal. We also test inflammatory biomarkers, and you see here in these graphs the most important cytokines. And we have reductions, significant reductions before and after surgery. We have significant reductions after surgery for interleukin-1 beta and protein C reactive, reactive protein C. And we asked and treated these results with statistics to try to find a correlation of the high levels of those cytokines before surgery. Are the patients having high levels of the cytokines related to any issues? Yes, and then we find a correlation with patients having high levels of CPR and interleukin-1 beta with ill-fitting metal crowns and amalgam restorations, as well as with root treatment teeth with periapical lesions. Regarding the healthy aging parameters, we tested 2, which is the telomere length. It's an extension of our chromosomes, and the longer, the better. And we tested also the activity of our mitochondria. These mitochondria we measure with an index before and after surgery. And the quality of a mitochondria, this organelle activity, is the capacity to retain energy and to produce energy. And this index gives us this performance. In these 2 pictures, you see again these 2 parameters before and after surgery, and both of them increased after surgery. Again, treating with a statistic, we saw that a better performance of mitochondria are related to the placement of zirconia implants, in this case, SDS implants. So with these results, we can state that aging and inflammatory parameters improved with the all-in-one protocol, and the placement of zirconia implants may be related to a prevention of systemic diseases. We are also very much worried about long-term clinical outcomes of zirconia implants. And the data from SDS implants are ready to be published. What I can tell you, just tease a little bit, we performed this study with 121 patients that received 284 implants on the same site of a titanium explantation. And we evaluated the outcomes having 8.5 years average of follow-up, reaching a cumulative survival rate of 98.74 to 100% of survival, with stable marginal bone loss after 1 year, 2 years, or more than 2 years of those implants loaded implants. We also saw an improvement on soft tissue health. And here you see 3 pictures with a reduction, significant reduction on 3 parameters that we evaluated: plaque adherence, bleeding on probe, and probe depth. So soft tissue was also improved with our immediate implantation of SDS implants. And this is, again, related to the macro design of zirconia implants, especially SDS implants that has a distinctive transgingival part with 3 millimeters high. And this implant also has a tulip shape that resembles the anatomy of the tooth, and that helps on the support of this crescent bone. And this all together help us on optimizing the soft tissue management, reduce tissue recession, facilitate maintenance, and this all together help us on prevent peri-implant diseases. Our stability is also depending on the macro design of the endosseous part of this implant, as this has varying depth on the endosseous part of the implant, and you can reach first stability even in very challenging situations like bone class 4. And for bone class 1, what we saw together with the drilling protocol, you reach areas called like healing chambers that help us on second stability and osseointegration of these implants. And so this is why we are having such high survival rates with these implants after more than 10 years follow-up. I'm happy also to share with you that we are running a clinical trial in the United States since November 2024. And this is all over the United States in different study centers with different operators, with different patients. And our objective is to analyze the real clinical evidence of immediate placement of SDS implants. Instead of having, like in university, where you have a controlled situation of a study, in this case, we are evaluating what happens in the office of all of you in a real situation. And our objectives is the same. Our outcome measures are gingival status, cumulative survival rate, marginal bone loss, pink aesthetic score, and PROMs, patient report outcome measures. And I'm very happy to share, he will be here, Dr. Callie Blodgett is the one that has already 15 implants with 6-month follow-up after loading. And I guess in April, we are able to publish the first results of 1-year follow-up after loading of those implants. And this is a very interesting clinical trial to test the real outcome of SDS implants after immediate implantation. And just to have an overview how this study is coordinated and seriously made, this is a little bit of the documentation that each site must do. So pictures of each stage, all implants are digitally planned, and for each follow-up, you have also padronized pictures and padronized x-rays that we could measure precisely and very correctly, for instance here, pink aesthetic score and marginal bone loss. That's my life. And I'm coming to the end of my presentation, and that is for me an enormous pleasure to present our last publication, where we did a clinical study as well, and we asked the patients to score their quality of life using a visual analog scale like this one here. We asked these patients, and it was 54 patients that received 272 implants in 3 different countries, Germany, Austria, and Spain. This is a multi-center European study about quality of life of the patient after immediate placement of SDS implants. And the outcome, the results were very interesting. We used for this study a specific questionnaire that evaluates not only the quality of life, but functional limitations, psychological discomfort, physical pain, physical and social disability, and handicap. And we saw improved quality of life, social interaction, and productivity, with very interesting differences, cultural differences. And you read the paper because this is really interesting to see the difference between the countries regarding the culture and the answer of the patients regarding quality of life. I give you this tease just to make you curious about. And what I'm talking to you is just to end up with an information. SDS science is on the top of the highest research. We are performing what we call patient-centered research. And for instance, this is the prompts, the patient report outcome measures. And if you go in PubMed, you see that there is an interest on the last 10 years on what is the quality of life and satisfaction of the patient after the implantation, after immediate implantation, zirconia implantation. If you check prompts and zirconia implants in PubMed for the last 10 years, you find out only 17 clinical studies, and one of those is ours. So thank you very much for your attention, and I'm more than here at your disposal to answer any questions. Thank you.